wellness revolution starts now.
Hello, I'm Dr. Steve Hotze. Welcome to today's program. I want to discuss with you allergies. Allergies are an abnormal reaction by your body's immune system to normal occurring substances that we see in the environment. Things like weed pollen in the fall, tree pollen, when your car gets covered with that yellow film during the spring. So that's tree pollens. And then you have grass pollens late spring, early summer. Year round, you can have mold problems. And mold, of course, if you live along a coastline, particularly in the warm coastline, like in the southeastern states and in along the Gulf Coast in Texas and over there in Florida, and all along the eastern seaboard, you're going to get a lot of mold because of the humid weather. And mold loves humidity and warm humidity, and it thrives on that. And that's a year-round problem with mold spores. And then you've got animal danders, you've got dust mites in the bed, and then of course you've got foods that can cause allergy problems. Wheat, corn, egg, milk, yeast, soybean are the big six. Peanuts also cause it in certain individuals. But foods can be a very significant problem, which adversely affect the immune system. And allergies cause the immune system to make antibodies trying to fight off the allergens. Allergens are substances that create allergies. So you have allergens and you have antibodies to the allergen. Your mast cells, these are cells that line the respiratory tract and the gut tract that make antibodies, IgE antibodies, to try to block the allergy. And what happens if you were born and you have a diathesis or predisposition genetically to allergies, and they oftentimes run in families, and about 40% of the population has problem with allergies. If you have those problems with allergies, every year you're exposed to those allergens over and over. Every year you're going to have a stronger reaction. The immune system can go into overdrive, and of course that produces all the allergy symptoms you think about. You can get drainage, postnasal drainage. You can get sinus congestion. You get sinus infections, sore throats, ear infections, bronchitis, asthma. You can get gastrointestinal problems. You can have eczema. You can have skin rashes and disorders of that sort. All these things can be caused by an abnormal reaction by your immune system to normal substances. Now, it's interesting that because they tend to run in families, that we see this in our practice, that maybe a mom or dad had allergies and their kids, when they start growing up into their young life, well, they begin to have allergies too. And allergies, of course, can lead to a host of infections because you've got this chronic drainage, which is like a culture media for bacteria. Next thing you know, you have a bacterial sinus infection, or you got strep throat, or you got ear infection, inner ear infection, or you got bronchial infection in your lungs. And you end up getting on antibiotics, and the antibiotics are meant to kill those bad bacteria, but you have healthy bacteria in your colon, kills off some of that. You get yeast overgrowth that produces toxins that depress the immune system, make you more reactive to allergy, more susceptible to infections. You get on this cycle of illness with allergies. And we've got to break the cycle of illness. So what commonly most conventional doctors do is go take an antihistamine or take a decongestant. Used to be all that was prescription. All the antihistamines and the decongestants were prescription items. They're no longer that. You can buy them over the counter. The doctors may want to give you steroids. They give you a dose pack, prednisone dose pack, or they give you a shot of dexamethasone or some steroid to help relieve the inflammation and produce cortisol levels that relieve the inflammation in your body. All those medications or the lack of those medications are not what cause you to have allergies. Allergies is an abnormal reaction of your body's immune system to normal occurring substances. So what those medications do is they block the histamine that's produced by the mast cells. You take an antihistamine. Antihistamine is against the histamine. When you have allergies, your mast cells rupture and they produce histamine, and that causes the fluid drainage and it causes a constriction of the capillaries, and then it causes it causes the dilation of the capillaries, and it causes the drainage, which lead to the infections. So you take an antihistamine, that isn't relieving the underlying allergy problem. What it's doing is blocking it, and they come with a host of symptoms. Over time, you don't want to be taking a drug every day of your life. It has to be broken down by your liver. It's going to put stress on your immune system, on your liver, and it's not going to be healthy for you. The best way to treat allergies is to block the antibody production by the mast cells. And there are ways to do that. Historically, over the years, allergists gave allergy shots. You'd get them once a week, and you'd have a dose of the very things that you're allergic to in diluted amounts, and you get those shots. You'd get tested, and they see what you're allergic to, and they give you the shots once a week. Well, those shots could cause problems. People could get anaphylactic reactions from them, and it causes time. You got to go to the office, sit there, wait, take a shot, then wait and make sure everything's okay. Once you got on a maintenance dose, sometimes you were allowed to give those at home, but those were time-consuming to do that, and people don't routinely like to get shots, so they would go back to just taking antihistamines, and oftentimes those shots really didn't work. You didn't get good relief from it. So then probably somewhere in the order of 30 years ago, there was 30 to 35 years ago, ear, nose, and throat. There are two types of allergists. There's conventional allergists, which come out of internal medicine, and then you have the ear, nose, and throat allergists, which come out of ear, nose, and throat specialty. And doctors that were ear, nose, and throat began to use sublingual drops. They'd take the allergens that people were getting in the shots once a week, and they would dilute them down and put them in drops that you take 3 drops under the tongue every day, and that would block the allergy reaction. And we began using that back in somewhere around 96 in our practice here. I started my practice as an allergy practice back in 89 here in our current location. And so we gave shots initially, and then we started using the sublingual drops and had great success on that. And then as time evolved, there were some other allergists around the country who began to use low-dose allergy treatment and low-dose immunotherapy, where they would use a very low dose of allergens, and they would give it instead of on a daily basis, they would give it once every 6 to 7 weeks. And that the allergy, rather than like in the drops of the shots, which contain 30 or 40 allergens of wheat, tree, grass, pollens, decimate, mold spore, and animal danders, at the most, that's all they would contain. They began to use up to 300 and 400 allergens of all varieties. That includes all the airborne allergens and pollens, molds, etc. It includes all the various foods, and also it includes chemicals. So it's a very low dose. And it's hard to imagine, how does low dosing allergens block the mast cells from producing histamine? It just does. We found it to be very successful. So we tried it as we learned about it. We tried it here at the Hotze Health and Wellness Center. And what we've done is we've graduated most of our guests that were taking sublingual drops under the tongue every day. We've graduated many or most of those to the allergy sublingual low-dose immunotherapy once every 7 weeks. And what we do is we do some testing on you, and we get a good history, and then our allergist here will determine the starting dose, and we'll see how you do on the starting dose and then adjust that as we go along until we get a dose that relieves your symptoms. And then you maybe take those drops once every 7 weeks for 2 or 3 years, and then you can go on a maintenance once or twice or 3 times a year. And that keeps your allergies at bay by blocking the mast cells from producing the histamine and the antibodies to the allergens as you come in contact with them. So this is a great breakthrough, and we've been very pleased with the result we've had. I would say 80% of the people, it's the old 80-20 rule, 80% of the people that start the allergy treatment, once we get on the right dose, they really have great success. If they've had asthma, their asthma is gone. If they've had severe recurrent sinus infections, it's gone. It's amazing in those guests, and we call our patients guests, in whom it has an effect. So if you are having significant allergy problems, or members of your family are, please don't hesitate to give us a call, and we can get you on a path of health and wellness naturally so you have energy, vitality, and enthusiasm for life, which allergies can take away, as you well know. So give us a call here at 281-698-8698 and visit with one of our new guest consultants. I'm Dr. Hotze. Thank you for joining us, and God bless you.
Physician's Preference Pharmacy is a compounding pharmacy specializing in custom-made prescriptions made especially for you right here on site in our compounding lab. Compounded medications offer a unique solution because you're not one size fits all, and we believe that your medication shouldn't be either. You may require a dose to be made that is not commercially available, or you might even be allergic to an inactive ingredient in a medication, which may present a barrier to treatment for you and requires it to be made without that bothersome ingredient. Your body has unique needs, which means that you deserve a customized approach. So if your medications aren't helping you feel your absolute best, then consider speaking with your doctor about having your medications compounded today.
Information provided on this program is neither intended nor implied to be a substitute for professional medical advice and is not intended to replace the services of a physician, nor does it constitute a doctor-patient relationship. You should not use information from this radio program to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. If you have or suspect you have an urgent medical problem, promptly contact a professional healthcare provider or call 911. Dr. Hotze's Wellness Revolution advises you to always seek the advice of a physician or other qualified health provider prior to starting any new treatment or with any questions you may have regarding a medical condition. Any application of the recommendations from this program is at the listener's discretion.